Hello friends, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kaithal. This is class number 16. In our today's class, we are discussing important signs and symptoms of different important disease conditions. So everyone, let's begin. First disease condition is TOF or tetralogy of Fallot. It is an abnormal heart condition. In this, four things are included: pulmonary stenosis, overriding of aorta, ventricular septal defect and right ventricular hypertrophy. Important signs and symptoms of tetralogy of Fallot disease is clubbing of fingernails. Next, cholecystitis. Cholecystitis means inflammation of gallbladder. Gallbladder is an organ which stores bile. Bile is produced by the liver. In cholecystitis condition, Murphy sign is present. Murphy sign means pain in the right upper quadrant. Next is syphilis disease. Syphilis is a sexually transmitted disease. It is caused due to Treponema pallidum bacteria. Important sign and symptom of this disease is painless cankers. Next is Graves' disease. Graves' disease is also known as hyperthyroidism. In this condition, important sign and symptom is exophthalmos. Exophthalmos means bulging of the eye out of the orbit. Next is Addison's disease. Addison's disease, also known as hypocortisolism. Hypocortisolism. In this disease, important feature is bronze-like skin pigmentation. Bronze-like skin pigmentation. Next is emphysema. Emphysema is related with the lungs, in which air sacs in alveoli of the lungs are damaged, and due to this patient have shortness of breath. Important signs and symptoms of this disease includes barrel chest. Next, pulmonary TB. Pulmonary TB is caused due to the Mycobacterium tuberculosis bacteria. Important sign and symptom of this disease is low grade fever. Next is Cushing syndrome. Cushing syndrome is due to high cortisol level for a long time period. Important sign and symptom of this disease is buffalo hump. Next is malaria disease. Malaria is also known as Plasmodium infection. It is caused by the Plasmodium parasite transmitted by the bite of infected mosquito. Important sign and symptom of this disease is stepladder fever. Next, deep vein thrombosis, DVT. DVT is a blood clot in deep veins, usually in legs. It becomes serious if the clot moves towards the lungs and lodges there. Important sign of this disease is Homan's sign. What is Homan's sign? Homan's sign is pain in the calf of leg upon dorsiflexion of the foot with the leg extended. Next is multiple sclerosis. Important signs and symptoms of this disease, together known as Charcot striae. It includes nystagmus. It means involuntary eye movement. Nystagmus means involuntary eye movement. Second is intentional tremors are present, and the last is dysarthria. Dysarthria means weakness in muscles of speech that cause slowed speech. Next condition is Buerger's disease. Buerger's disease is the inflammation and thrombus in blood vessel. In this disease, important characteristic is intermittent claudication. Intermittent claudication means pain in leg due to poor blood supply causes impaired walking. Pain in leg due to poor blood supply that causes impaired walking, known as intermittent claudication. Next, thrombophlebitis. It is an inflammatory process that causes a blood clot to form and block one or more veins, usually in legs. Important character of this disease is Homan sign. Next most important disease, myocardial infarction. It is also known as heart attack. Important signs and symptoms of this disease are crushing, stabbing pain radiate to left shoulder, neck and arm. Crushing, stabbing pain radiate to left shoulder, neck and arm. Second one is presence of Levin's sign. Levin's signs means clutching of chest. Third is pain do not relieve by administration of nitroglycerin. Next is Cushing triad. It includes bradypnea, bradycardia, systemic hypertension. Friends, please click upon the like button. Thank you. Next, meningitis. Inflammation of brain and spinal cord membranes, typically caused by infection. It may be viral, bacterial or fungal, known as meningitis. Important signs of this disease are Brudzinski sign and Kernig's sign. Next condition is appendicitis. Appendix become inflamed in this condition and filled with pus that causes pain. Appendix is a pouch-like structure attached to a start of large intestine that has not known purpose. There are three important signs and symptoms of this disease that are also helpful in the diagnosis of this condition. First is rebound tenderness at McBurney's point. Second is rousing sign. Rousing sign means palpation of left lower quadrant, iliac pain in right lower quadrant. Third is psoas sign. In this, pain from flexing the thigh to hip. Next, patent ductus arteriosus. It is an abnormal condition of heart. In short, it is also known as PDA. PDA is a heart defect opening between two blood vessels leading from the heart. Important characteristic sign, washing machine like murmur present. Next is Guillian Barre syndrome, GBS. Immune system attacks on nerves. This condition triggered by acute bacterial or virus infection. Important characteristic of this disease is ascending weakness of muscles. Hirschsprung disease. Hirschsprung disease is also known as toxic megacolon. Important sign and symptom of this disease is ribbon-like stool. Last, measles. Measles is caused by the rubeola virus, so it is also known as rubeola disease. Important signs and symptoms of this disease include presence of Koplik spot. What is Koplik spot and where it is found? Let's learn. Spots found in mouth, especially inside the cheek, on buccal mucosa, look like the tiny grains of white sand surrounded by red ring. So friends, these are few important disease and their important sign and symptom. I hope you have enjoyed this video. If you find this video is helpful, then please click upon the like button, share this video with your friends and subscribe our YouTube channel for nurses preparation for more such interesting videos. All the best.